the epicranius lying on top of the cranium, the epicranius. This is the temporalis. Here we can see the orbicularis oculi. Little sneeze coming out. Orbicularis oculi. This is the levator labii superioris. Here is zygomaticus minor, zygomaticus major. This is the masseter muscle, elevating the mandible on chewing. This is the buccinator, This is the risorius, And this is depressor anguli oris. Depressor anguli oris. Surrounding the mouth is the orbicularis oris. And here is mentalis at the chin, the mental region. On the neck, we can see the sternocleidomastoid here, having attachments to the sternum and the clavicle here, and the mastoid process here. This is the sternohyoid, the omohyoid, and we'll look at the digastric on the other model because it's a little challenging to see on this one. So on this one, it's a little different, but we can see the epicranius here. What's this one? Orbicularis oculi. This is what's different. So this is levator labii superioris. Here is zygomaticus minor, and this is zygomaticus major. Here is the buccinator. This is risorius. This is masseter. What do we see here? Orbicularis oris. This is depressor anguli oris. Here we can see sternohyoid and omohyoid. Here's sternocleidomastoid. And here we can see the anterior belly of the digastric and the posterior belly of digastric. Right here, this is sternohyoid. Upper limb. You can see the muscles that are going to extend at the wrist. So this motion from the anatomical position is extension, like so. So for these muscles, starting towards the radius, just on the side, we can see brachioradialis. So that's going to have an attachment on the brachial region and travel along the radius, brachioradialis. This is extensor carpi radialis, longus. Extensor carpi radialis longus. This is extensor carpi radialis brevis. So it's shorter. This is extensor digitorum. So it's going to have tendinous attachment to multiple digits here. So extensor digitorum. This one, if you trace its tendon, it's gonna go to the pinky finger. So this is extensor digiti minimi. Extensor digiti minimi. And this one is extensor carpi ulnaris. Extensor carpi ulnaris. All right, for the flexor muscles in the antebrachial region, we can see here that the fibers from this muscle are traveling at a little bit different of an angle than the other ones. And so this one's gonna have an attachment onto the radius, about right here. And so that's gonna be the muscle that's responsible for pronation. And that is the pronator teres. Pronator teres. This muscle is going to travel along the radius. It is the flexor carpi radialis. Flexor carpi radialis. This is that one that some of you may not have, which is the palmaris longus. Palmaris longus. This is going to be the flexor carpi ulnaris, traveling along the pinky side. So flexor carpi ulnaris. For the upper portion of the arm, the brachial region, we can see the biceps brachii. There's going to be a short head. So the short head and a long head. And then deep to the biceps brachii is the brachialis muscle here. So overlying some of that is going to be the deltoid muscle, which I'm piecing together here. If I can put it back together. It's kind of a stubborn roll. There it is. So deltoid. Deltoid is here. We can see the triceps brachii. So this is going to be, where is this? Left arm. So this is the lateral head, and this is the long head of the triceps brachii. Here you can see supraspinatus and infraspinatus. This is teres minor, and this is teres major. So from an anterior view, this is rectus femoris. This is vastus lateralis. Vastus medialis. Moving medially, this is the sartorius. This is adductor longus. This is gracilis. This is adductor magnus. From a posterior view, laterally is going to be biceps femoris. And medially is gonna be semitendinosus, which is superficial to semimembranosus, which you can see here and here, semimembranosus. This is gonna be here, tensor fascia latae. Tensor fascia latae. Okay, lower leg muscles. This is tibialis anterior, moving laterally, extensor digitorum longus, extensor digitorum longus. This is fibularis longus, fibularis longus. Here is soleus, which is deep to gastrocnemius, right here. This is gastrocnemius. And that is the lower leg